All right, frequently asked question number 2 is, what is it? Oh, what is a typical session? What does a typical session look like? Okay, so a typical session for me is first we start off with a check-in. How has life been? How's life been impacting mental health? How has mental health been impacting life? Sometimes that is the entire session, right? Sometimes life is chaotic or stressful or overwhelming and you just need to vent, get some things off your chest, feel supported, feel understood, feel validated. But sometimes we don't have much to talk about, or knock on wood, sometimes life is just going okay. And so maybe that check-in period does not last the whole session. And so I open up to anything else you want to talk about. This can be a relationship experience you had 10 years ago that you're like, hey, I'm kind of curious to explore that in therapy. Or a random past moment, you had a panic attack or something and wanting to understand that more, talk about that and that kind of thing. But if we don't have a ton to talk about one day, I have what I call mental health units, which are these collections of guided discussions, activities, questionnaires, things like that, around a variety of mental health topics that are like really helpful for most clients. So some topics within these mental health units could be cognitive distortions, which I do with almost every single client. We learn about cognitive distortions, which are these automatic negative thought patterns that we get into that really amplify anxiety, depression, hopelessness, low self-esteem, that kind of thing. Another really popular unit I have is my self-compassion unit, which is all about learning about self-compassion and learning to apply that to ourselves, because most of us are so mean to ourselves. So it's a really important unit to be able to kind of shift that thinking and find that gentleness with ourselves. I also have units on a lot of sex therapy specific things, especially around the 6 principles of sexual health. And then another popular unit is all about attachment theory, because attachment theory helps explain why we show up in relationships the way that we do, and kind of helps explain our own development, and a lot of different things in life. So if we don't, like I said, if we don't have a ton to talk about one day, we would dive into one of these units, and I have several years worth of units available. So most of my clients really enjoy having that support, that psychoeducational material to kind of guide them in sessions. We'll always have something important to do. And then if clients are open to it, I love ending all sessions with a short breathing exercise, usually just a minute of some deep breathing together, but no pressure. If that's not your vibe, that is okay too. I would say about half my clients don't want to do breathing, and that is totally okay. So once again, if you have any questions, any follow-up questions on what a typical session looks like for me, once again, shoot me an email. All right, that's all for now.